Whether you schedule it or not, having sex can increase your desire and lead to more sex. Up next, dealing with arthritis pain during sex can be tough. We reveal tools to make it easier and more pleasurable. Plus, can you tell fact from fiction? Our special guest walks us through some common sex myths. Coming up.
If you have a question for Dr. Leah, please send an email to questions@allhealthtv.com. Find out more about sex talk. Go to askdrleah.com.
Welcome back to Sex Talk. Today we have male sexual and reproductive medicine specialist, Dr. Josh White. Thank you so much for joining us.
Thank you for having me.
So today we're going to talk about common myths, and I have a few here that I hear all too often, so I just want to address. So tell us what your feedback is here. So ED only affecting older people.
So yeah, that's totally inaccurate. We've actually seen a lot more and more younger people, like we're talking, early 30s, early 20s, even as early as in their late teens, of people that are coming in with really debilitating erectile dysfunction. And I think that for many years, they basically were just kind of, it's all in your head, and they weren't given any treatment. And then it just kind of compounds that cycle because they are averse to having sex, so I think that the underlying pathology differs in older men and younger men, but it's very much a disease of all men.
What do you think is a major reason behind younger men having ED?
I think that at least in part, there may be an element of unrealistic expectations that they see consistently in, watching pornography or whatever, and that they feel like they have to perform like the people that they see on the computer or whatever, and that's just so not how it is. And so I think that there's that kind of anxiety cycle. Adrenaline starts pumping, their fight or flight response starts pumping when they're anxious, and that directly takes blood away from the penis and puts it towards the more essential organs. And so, if you're not having blood flow to the penis, it's going to be impossible to get a good erection.
Absolutely, and especially with obesity rates increasing.
Totally, yeah, that's a huge part of it as well. And then, with obesity, you also get increases in estrogen levels, decreases in testosterone, which also can have an impact on erectile function as well.
So now you hear myths on either side of this one. Masturbation either increases ED or decreases the likelihood of ED. Tell me about that.
Yeah, so I think that there probably is a component, I think it would be more so psychogenic ED, or where there necessarily isn't something wrong with the physiology of the penis, but when people are consistently able to get erections when they're masturbating, but they have difficulties in getting erections when they are with a partner, that's kind of one of the criteria that we use to help differentiate between the different types of erectile dysfunction. And so it's very hard because I don't think that there's a cutoff number for everyone where it's like, if you masturbate this many times, you're going to get erectile dysfunction. I think that there is, probably the more that you do it, if it's to a pathological amount, then you could have more difficulties in terms of having sex with a partner.
Okay, so this next one we hear all the time, right? What predicts penis size? Like you hear big feet predicts penis size, and I know that's been debunked, but then I've heard hand length or a ratio between ring finger and middle finger, ring finger and pointer finger. Talk to me about all of those myths.
Yeah, so like you said, foot size has been pretty much completely debunked. In terms of the hand size, the best data that I have seen actually came from in utero studies, when they would measure the length of the first finger as a predictor of what actually several health factors, including penile size and testicular size and what the testosterone would be. But probably the very best data that I've seen has actually been what the men's height is, and that correlated most strongly to the stretched penile length. And so, and the stretched penile length is a very good marker of what the erect length is going to be.
So could you elaborate just with your stretch penile length versus erect penile length?
Of course, yeah. So, you know, when we are measuring what a men's penis length is going to be, we can't really get an accurate representation because, you know, there's growers and showers. And so the best way that we can, you know, characterize it, the closest thing that correlates to a man's erect length is when you pull the penis on stretch just directly out from the body and you measure from the base to the tip. And so that is the closest thing to what the erect penile length is going to be.
So of all of these, height would be the one that's most directly correlated?
It seems like it, and there's not, like, even that data wasn't that convincing, and so I think that, you know, that data is just not great, but for sure feet is completely not correlated.
Okay, got you. What are some other misconceptions that you've heard about? What are some other myths you hear?
Yeah, so I've heard about, you know, men having low testosterone, wanting to get their testosterone up, and then also being concerned about their estrogen levels being too high. And so while it's true that, you know, estrogen levels need to be in an appropriate range, you don't want to completely suppress them. There was a really interesting paper that was published where they basically castrated young university men. And then they gave some of them testosterone and some of them testosterone plus an estrogen blocker, basically. And what they found was that the erectile function, libido, was much better in the group that had estrogen levels, like normal estrogen levels, as opposed to the men that that just had pure testosterone. And so it shows that there's kind of a complex interplay of these hormones, and that you know, having just a super high testosterone isn't the be-all, end-all.
Oh, awesome. Well, thank you so much. It was great having you.
Thank you so much.
We'll be right back with more Sex Talk.